Musculoskeletal pain is a widespread problem, affecting more than 30% of the global population. It can be acute or chronic, localized or diffuse, and often leads to significant disability and emotional distress. The causes are varied, ranging from tissue damage and inflammation to functional dysfunctions or even unknown origins. This complexity makes musculoskeletal pain a challenge for both patients and clinicians, as no single treatment fits all. Despite its prevalence and impact on quality of life, musculoskeletal pain is often underestimated and undertreated. Understanding its multifaceted nature is the first step toward effective management and improved patient outcomes. Additionally, the first-line treatment for musculoskeletal pain has been medication. However, recent guidelines emphasize the importance of preventative strategies, psychological therapies, and physical tools to minimize drug use. Non-pharmacological treatments, such as heat and cold therapy, are now recognized as effective complementary options. These approaches not only help manage pain, but also support a return to normal function and activity. The shift towards a more holistic, multimodal approach reflects the need to address the diverse causes and presentations of musculoskeletal pain, ensuring that patients receive comprehensive and individualized care. Therapy is one of the oldest non-pharmacological methods for pain relief. By applying an external heat source to a specific body area, tissue temperature rises, leading to several beneficial effects. These include vasodilation, increased blood flow, enhanced metabolism, and activation of pain-relieving pathways. Heat therapy can be delivered in various forms, such as hot packs, wraps, or baths, and is widely used for both general and specific musculoskeletal conditions. Its popularity stems from its simplicity, accessibility, and ability to provide comfort and relief without the need for medication. Mechanism behind heat therapy involves several physiological processes. When heat is applied, it activates temperature-sensitive nerve endings called thermoreceptors. These receptors send signals that can block pain transmission in the spinal cord, providing relief. Additionally, heat increases blood flow and metabolism, which helps deliver nutrients and oxygen to tissues while removing pain-inducing substances. The activation of specific channels, like TRPV1, also contributes to muscle relaxation and reduce stiffness. Overall, these effects combine to decrease pain, improve mobility, and support tissue healing. Heat and cold therapies have their place in managing musculoskeletal pain, but they work differently. Cold therapy reduces blood flow, swelling, and inflammation, making it ideal for acute injuries and the early inflammatory phase. Heat therapy, on the other hand, is best used after the initial inflammation has subsided, as it promotes healing and restores function. The choice between heat and cold depends on the stage of injury and the specific clinical scenario. In some cases, alternating between the two can provide additional benefits, but it's important to follow professional guidance for optimal results. Therapy is widely used for various musculoskeletal conditions, including low back pain, neck pain, knee pain, and wrist pain. Studies have shown that continuous low-level heat applied directly to the skin can provide short-term improvements in pain and mobility. For example, heat wraps have been found more effective than some medications for acute low back pain and knee osteoarthritis. Heat therapy is also beneficial for delayed onset muscle soreness, DOMS, helping both younger and older adults recover after exercise. Its versatility and safety make it a valuable tool in both clinical and home settings. There are several ways to deliver heat therapy, each with its own advantages. Conduction involves direct contact, such as with hot packs, wraps, or paraffin baths. Conversion uses energy transformation, like ultrasound or radiant heat, while convection relies on fluid movement, as in hydrotherapy. The choice of method depends on the area being treated, the depth of heat penetration required, and patient preference. Standardizing heat application with medical devices can improve compliance and allow for better evaluation of effectiveness in clinical practice. Therapy is generally safe when used appropriately, but certain precautions are necessary. Patients with active immune diseases, cancer, neurological disorders, skin injuries, or circulation problems should use heat therapy with caution. Maintaining skin integrity is crucial to prevent burns or irritation. Most reported side effects are mild and temporary, such as redness or minor burns, and resolve on their own. Using standardized devices and following instructions can further minimize risks, making heat therapy a safe option for most people. Deciding between heat and cold therapy depends on the phase of injury. Cold therapy is best for the initial inflammatory phase, typically within the first 48 to 72 hours after an acute injury. It helps limit swelling and pain. Once inflammation subsides, heat therapy becomes more appropriate, supporting tissue healing and restoring function. In chronic conditions or the later stages of recovery, heat can be especially beneficial. For certain complex pain syndromes, alternating between cold and heat may be advised, but always consult a healthcare professional for guidance. Pain is a common complaint, often resulting from trauma, overuse, or degenerative conditions like osteoarthritis. Heat therapy has been shown to be effective in managing knee pain by reducing stiffness, improving mobility, and enhancing quality of life. Clinical trials have demonstrated that combining heat therapy with exercise leads to greater improvements in pain and function compared to exercise alone. Heat wraps and other modalities can be safely used at home, providing accessible relief for those suffering from chronic knee pain. Heat and cold therapies can help manage knee pain, but their effectiveness may vary depending on the underlying cause and stage of the condition. Studies show that both methods can reduce pain and improve joint function in knee osteoarthritis. However, no significant difference has been found between the two in some trials. Sequential application, using heat followed by cold, may offer additional benefits for improving knee flexibility. Ultimately, the choice should be tailored to individual needs and clinical recommendations. Athletes frequently use heat therapy both before and after exercise. Before activity, heat helps warm up muscles, increasing flexibility and reducing the risk of injury. After exercise, it aids in recovery by promoting blood flow, nutrient delivery, and removal of metabolic waste. Studies have shown that heat therapy can improve joint flexibility and reduce muscle soreness, making it a valuable tool for both performance enhancement and rehabilitation in sports settings. Combination or sequencing of heat and cold therapies is an area of growing interest in sports medicine. Research suggests that heat therapy can increase ligament flexibility and reduce the force needed for joint movement, while cold therapy is effective for immediate pain relief after intense exercise. Some studies indicate that hot packs are superior for pain relief within the first 24 hours post-exercise, while cold therapy becomes more effective after 48 hours. This nuanced approach allows athletes to optimize recovery and performance. While heat therapy is widely used and generally safe, there are still gaps in our understanding. More high-quality research is needed to define the best practices for different conditions, populations, and delivery methods. Technological advancements, such as wearable heat devices and innovative modalities, are being developed but require further evaluation for safety and effectiveness. Integrating heat therapy into multimodal and multidisciplinary treatment plans could enhance patient outcomes and provide more personalized care. Heat therapy stands out as a simple, accessible, and effective tool for managing musculoskeletal pain, especially knee and sports-related pain. Its benefits include pain relief, improved mobility, and support for healing. While generally safe, it's important to use heat therapy appropriately and consult healthcare professionals when needed. As research continues and technology evolves, heat therapy is likely to become an even more integral part of comprehensive pain management strategies, helping people return to normal function and enjoy a better quality of life.